another issue that may occur is, let's say we do a treatment, everything looks great, your erection looks great, everything functions great. However, during the flaccid state, you could have this retraction force, right? We already know this. You have it now. Your penis says, if let's say your erect length is 6 inches, your flaccid may be 2 inches, right? You recoil, right? That force still exists. So what happens is when we put all this collagen here and you're this size, the penis is still going to try to retract. So it might cause some distortion during the flaccid state. Sometimes the glands will tuck under a little bit and some of the skin will overlap the glands. So you may look partially uncircumcised, right? Or fully uncircumcised, but the erect will look super. Now, if that were to occur, and you say, hey, I don't like looking uncircumcised, well, the remedy for that is the lengthening device, okay? And we'll discuss that on a separate video, consent and so forth, or you'll review it on my website. So we could put the lengthening device in and keep you hanging long all the time, and perhaps the erect length increase as well, increase your erect length. All right, I just want to make a brief comment about those who have had prior filler treatments, not from myself. Let's say another doctor used temporary treatment, temporary filler. Those situations are not an issue with us, because if someone were to have a temporary filler, and obviously temporary fillers don't mount very well, they of course dissolve, you have to keep on doing it every year, it's very cost prohibitive, it's not cost effective whatsoever. So if a patient comes in that had a prior temporary filler treatment, we could treat them. It's not an issue. My filler will result in permanent collagen production, so it's irrelevant if you have prior filler there. Now let's talk about patient participation. It is extremely important for the patient to participate in his care, right? Compliance is critical. Remember, we have this penile shaft. We're going to put filler in there. We're going to put a special wrap on. We have to make sure that we take care of that, because if the wrap is not done correctly, here's an example. If you wrap the penis and make it very tight in the middle, what do you think is going to happen? The gel in this area may displace, right? So if it moves here and moves down here, and then the collagen forms after, what do you think the shape is going to be like? It's going to be like an hourglass, right? Now that doesn't happen often because patients know not to do that. It's very simple. But you have to be aware of these things. I've seen it on occasion. Now it's correctable, but why put yourself in that position, okay? Also, there are medications you need to take. Very important. Remember we mentioned that the filler induces or initiates this inflammatory reaction, right? That produces collagen. Now, let's say you didn't take the steroid medication that you're prescribed. Let's say you didn't take it. Well, the inflammation may go unchecked, elevate to a point where it might cause what? A skin sore, right? So there's a reason why we give you these medications. There's a reason why we give you a protocol of exactly how much to take and when. It's very important to do that. So you must participate in learning how to wrap correctly. You must participate in taking your medications correctly. There are supplements like natural supplements I want you to take, foods, for example, oranges and sunflower seeds for the nutrition aspect, because we need certain vitamins and minerals to build collagen. I have to make sure you have that on board. Also, when it comes to communication, okay, you're going to wrap correctly, great. You're going to take your medicine. You're going to have the food supplements and so forth. We also recommend oatmeal and probiotics, and we'll discuss that in a bit. But the idea is communication. If you're going to do all this, great, but there's another step. You're going to take pictures along the way so we could see what's going on. Well, you're going to take pictures every time you change your wrap. For example, let's say you had a treatment on Monday, and you're going to change your wrap on Thursday. So after the wrap comes off, you shower up, right? You soap up everything nice, rinse and dry. You take pictures for us so we can see the skin. And then when you put a wrap on, right, we want to see pictures of that wrap to make sure you're doing it correctly. Now, if you don't do that, we cannot make any corrective. We can't correct anything that might be wrong, for example, right? So the idea is to be in communication. We want to see what you see so we can guide you through this process and get optimal results. That's the objective, optimal results. Now, regarding the treatment and so forth, you know, it's common sense that if you had a treatment, right, you can't have intercourse. Right, that makes sense. So for 30 days, you have to be inactive, right? It was a little unusual, but I had some patients, not many, like after day 10, 12, they'll have intercourse, and what's going to happen is the filler itself will move, right? So you have a filler here, you put pressure on this, you're going to move that gel. So obviously you're going to refrain, all right, from intercourse or anything causing pressure on the penile shaft and glands and so forth in the scrotum. So refrain from that, obviously. After you have your first, second, or third treatment, right, there could be some complications that occur 6 months later, a year later. They're not common. However, for example, if you have intercourse and have a micro trauma of the skin, let's say you don't even know, a little break in the skin, you could introduce bacteria, which could potentially cause an infection. Now, that happens on occasion. We don't see it often. However, we treat it with antibiotics, all right, and it resolves. Okay, things like that may occur. Sometimes when you have what's called collagen remodeling, and that happens with collagen all over the body. Now that you have collagen here, remodeling will occur. And what happens is the body will dissolve some collagen and rebuild it, depending on how much tension there is in the area. And that's, again, a normal process. But by dissolving some of the collagen, it may release some of the oil. And the oil will now react with the immune system again to be recaptured and make collagen. So there's kind of a cycle going on. Okay. But sometimes if you get some remodeling, let's say if you bend the penis a lot in a certain area where there's pressure points is where that's activated, the collagen remodeling. So if the collagen is dissolved a little bit and releases a little oil, the immune system will come in and recapture it and make collagen again. So it's kind of a back and forth type of situation. So in essence, it's a net negative gain or loss. It just remains constant. But here's the key. If it releases a lot of oil, it might cause it might cause an inflammatory reaction that becomes visible. You might get some swelling. In that case, again, not common, that case would give you some medicine to resolve that as well. Now, let's say you had your treatment, you're happy, you've achieved your goal, right? You have your 4 3/4 girth to 6 3/4, you're content. But maybe 5 years later, maybe 10 years later, you notice changes occurring. Because as we get older, things change no matter what. So maybe the skin is getting a little less tight. Let's say the blood flow into the penis is not as much. Maybe you're not as firm. Maybe we need to do something. So down the road, there's a possibility that you may need some filler in the location. Maybe as we get older, the skin gets loose. We notice this on the face as we age, but it happens in other parts of the body as well. So as we get older, and if the penile skin starts to kind of get a little looser, maybe you'll need a little tightening. I call it the facelift of the penis. You could tighten it in several directions. So that's a remedy for that. So we can take care of it. Now let's again review some potential side effects, some potential issues when it comes to any surgical procedure. Okay, I've touched upon some of them, but I just want to review them quickly. So let's say, for example, we're doing the filler, right? Filler injection. Of course, there'll be a little bleeding, minimal. If we do a surgical procedure, there's a little bleeding. That's all normal. So we expect things like that. May you have discomfort afterwards? Unlikely, but it may happen. We talked about infection. We try to minimize that and keep it close to zero. Again, I'm very particular about the cleanliness of my rooms, the air purification systems we have, and the sterility and sterile gloves, for example, we use, and all these things. So we want to prevent that. When it comes to scarring, it's very rare. Let's talk about scarring. Probably 1 in 1,000 treatments will get a patient that forms a skin sore that's a little bigger than usual. Okay, so what we do is we allow that to heal slowly, and it fills in beautifully, and you might get a little scar, right? It depends where. Usually it's underneath, right? You get a little scar here, or sometimes on the top. Now, if that were to occur, it might take another 60 to 90 days to heal, but it heals beautifully. Okay, again, it's a rare event, but it can happen. And even the scar that develops is a very high quality, good quality scar with good skin color. Okay, so that's our experience thus far. Okay, we mentioned about swelling. Swelling is normal during the healing process, and then it comes to a conclusion. Periodic swelling after is very rare. We talked about a cause of swelling could be the remodeling process. If this swelling goes up a little bit, let's say even a year later, we give a medicine to remedy that as well. Let's talk about skin changes. Sometimes the skin may change its color a little bit. Sometimes we get what's called hyperpigmentation. So, for example, let's say you achieve your size, but you notice it's a little darker over here, a little, darker color, maybe a little bit over here. That's due to either deposition of some red blood cell elements into the skin or certain cells called melanocytes depositing pigment. Okay, usually we can take care of that and lighten that area with a skin bleaching agent, okay, called hydroquinone. So usually there's a remedy for that as well. When it comes to numbness, okay, basically there's a net plus feel, okay, or sensation when you go from this to this. Okay. Now, what happens here is that when you develop collagen, there's tons of nerves here, right? Nerves everywhere. When you develop collagen, the collagen may kind of sit on top of the nerve a little bit, right? It's like putting a glove on your hand. You can still feel, but it might feel a little less, right? A little less sensitive. Now, when you go from this size to this size, and let's say there's a slight drop in feeling here. Usually it's here is no problem. This whole area stays normal and sensitive as it normally was. Here it might drop a little bit. However, during intercourse, since you have more pressure on this area, there's actually a net plus feeling to it. Okay, so there might be a slight drop in feel, but as you enter the vaginal canal, anal canal, there's more pressure on there, and it'll appear as though there's more sensation. Okay, so it's not truly a numbness per se. There's a drop in sensation a little bit. Not everybody, in some. When it comes to, let's say, blisters are very rare. Blisters may occur on the glands. They heal fine. A blister's a blister. Again, nothing to worry about. When it comes to, let's see, collagen production and the failure of it, I've never seen that actually. When we put the filler in, collagen will follow. Collagen production must follow. The only difference is the quantity. Genetics plays a role here. For example, if I take 10 penises like this and 2 or 3 treatments later, we expect it to be like this. But maybe it won't be as thick as this because the collagen production wasn't as high. We do expect an average of 3/4 of an inch to 1 inch gain per treatment. But some men get half an inch, right? Let's say 5%. On the other spectrum, 5% will go over an inch. So we don't know where you're going to fall. But the idea is if you were to follow instructions, take your medicines, take the food that we want you to eat for mineral and vitamin purposes, the risk of that situation is less, right? But still, we see some patients with half-inch gains. That doesn't mean you're not going to reach your goal. You just might need an extra treatment or two, okay? Now, you'll hear words like granuloma, any kind of filler, facial filler, penile filler, it doesn't matter what it is, temporary filler, permanent filler, can cause what's called a granuloma. What is a granuloma? It's just like a glorified pimple almost. Okay, it's not really a big deal. It usually resolves on its own, or it might need a steroid injection. So, for example, if I put filler in your face, if you get a granuloma right here, you might feel like, wow, it's a little pinchy. It hurts a little bit. It feels like a pimple. In that case, it usually is going to resolve on its own, or we inject the medicine just to dissolve it. Okay, we haven't had granulomas here that we're aware of because there's no symptoms of granulomas. Okay, so I wouldn't worry about it here, but if you're doing it in the face, it's different. Okay, it's obvious. It's more sensitive in the face, more blood flow, more reactivity in the face. So you're going to feel like pimple-like granuloma on your face. But again, nothing to worry about. Regarding erectile dysfunctions, patients say to me, hey, if I go from this size to this size, am I going to have erectile dysfunction? Is it going to affect my ability to have an erection? Absolutely not. The erectile dysfunction will occur if you have diabetes for a long time, high blood pressure for a long time, trauma to the penis, because you have to affect the nerves and blood vessels going deep into the penis, right, to get erectile dysfunction, not having the ability to have blood flow coming in and out. We work at the skin level. We're not even near all those deep vessels, all those nerves that affect or cause an erection to occur. So when it comes to erectile dysfunction, the filler itself has no role whatsoever, directly or indirectly, to affect that. So in other words, not to worry. When it comes to skin texture, a patient says, hey, what is this going to feel like? They take their penis here, they grab your skin, right? It's like grabbing this skin. You see how thin the top skin of the hand is here, right? When we put gel in this, okay, we put gel in that and you form collagen, that skin becomes like this skin. You see the difference? If you see the thinness here and the thickness here, that's exactly what it's going to feel like. So if you want to know what's the skin texture going to be like, what is the change going to be like, just grab the penile skin, right? You can grab your hand skin, it's the same, pretty much thinness. And now you go to your arm and grab this skin, and you got a lot more collagen here. That's exactly what it's going to feel like. So there's your texture, answering your skin texture question.